Carla Boisvert had just begun to grieve her mother's death when she saw it added to the province's death toll.
That's really what hit me when I read that a person in their 60s died in the Saskatoon zone. And I was like, that's my mom. And she had no name. She was just a number.
Her name was Patricia Lingle. Her death, says Boisvert, an indicator of strain on the healthcare system. Lingle was dying of cancer, but still able to stay in her own home with nursing support until staffing shortages interrupted her care.
If a nurse gets exposed, then they have to be on the 2-week quarantine. So there was some days where no one could come. And that, in my mom's case, literally meant she was sitting in her own filth.
So Lingle had to go to a Saskatoon hospital, and that's where she was exposed to the virus. The grandmother died from COVID-19 within days.
This is the ripple effect.
Now the province's Medical Association and Nurses Union are crying foul at Saskatchewan's vaccination rollout plan. This week, the plan was adjusted to only prioritize healthcare workers who work in long-term care homes or directly treat or test COVID-19 patients. The rest will get the vaccine in order of age, oldest to youngest, like most everyone else.
It's beyond logic why they would think that this reimagining of the vaccination program is one that would keep health workers across this province safe.
Premier Scott Moe blames a short supply of vaccine. He says health officials will re-examine the decision, but
the stark reality of the situation is that elderly people tend to have more serious outcomes from COVID-19.
She was always someone who wanted to help other people.
Boisvert wants to honor her mother, a retired nurse, by reminding people that we can all do our part to relieve pressure on the system. Bonnie Allen, CBC News, Regina.